Dr. Rayanne Booker from Metro Health Grand Rapids, Dr. Brandy Lovelady from KISD, City of Grand Rapids Commissioner Nathaniel Moody, and Grand Rapids Public School Board Member Kimberly Williams, and more. If funded, we intend to involve other neighborhood associations from our areas of interest from our areas. Areas of interest for us are data warehousing, mobile testing, personal protective equipment, as well as food distribution. Some of my team members will speak to the finer points of our work. Coming up first is our local educator and community organizer, Rodney Brown.
Good morning, commissioners, and as Mr. Williams has shared, thank you so much for giving us this time this morning. One of the points that we intend to work diligently around is collecting data and working with existing organizations like Kent County to make sure that as data is compelled for us to utilize it in ways that does not challenge processes or the integrity of processes. We know that we're getting different information ongoing relative to the response that we're all engaged in to the COVID-19 crisis. And it's important that we gather grassroots data through our social media contexts and sites and those platforms, but as well through our newly designed Urban COVID Response Team website and app that we intend to build that will help us to continue to collect, analyze, and assess data. And so it's just really important, just want to stress the importance of us being aligned around the objectives with gathering data, and again, being able to use this data in ways that benefits all in Grand Rapids, but particularly those in the grassroots in the area codes that Mr. Williams spoke to. And with that, we have another team member as well who will speak some to the importance of mobile testing and contact tracing. I believe that's Mrs. Williams.
Good morning, commissioners. Thank you so much for your time. With regards to the mobile testing and contact tracing, we know that numbers came out just 2 days ago that there are 314 more cases of COVID-19 in Kent County and 5 more deaths. Thus, it is our desire to help aid in contact tracing and mobile testing, as we know that many African Americans are a part of our essential workforce and thus are particularly at risk. Thus, we will build our capacity to test residents on a block-by-block basis throughout the highest impacted areas. Individuals who sign up and request testing through our Urban COVID Response Team mobile app will understand that the state has a goal set to test 1 to 2% of the population. Our strategy would be to drastically increase our rate of success toward achieving that goal. We also are going to be using the website and the mobile app to help us survey residents, collect data, and create a database to support the information that we are receiving from our residents to provide impact to those communities and individuals who are being tested. And again, we want to be able to provide them with some education as well so that they have some resources and support to combat this debilitating disease in our community. So we want to make that contact tracing work. We want to scale that up to the maximum impact so that our community and our engagement with those strategies will help us be able to successfully support that in both the public and private sector. So again, we want to make sure that we are having impact again in data warehousing, contact tracing, and mobile testing. And then we also will have our next partner speak to Ms. Jordan. She's going to speak to our personal protection equipment plan.
Good morning, commissioners, and thank you for this time. As African American Task Force, we understand and we support the need for everyone to have access to PPE equipment during this COVID-19. Many residents and business owners don't have the resources to purchase the PPE, neither do they know where to get the PPE. Education and reliable information as to where to access these resources have proven to be detrimental to the large raft of our community. We are offering a direct services through our mobile unit, making it easier for residents and business owners to access the face mask and hand sanitizer. And as a small business owner on Granville Avenue, I would love to be able to offer those, the PPE equipment to my clients when they come into the business. And right now, they're very scarce, and it's hard. People are asking questions as to where do we get this information? How do we obtain them? And I think it's very crucial that all businesses along these corridors have access to offer their clients. A lot of people come into the businesses and the stores and do not have masks, do not have hand sanitizer. It's very crucial that we are able to offer these this opportunity for access to them. Thank you.
Good morning, Commissioners. Lionel LeGrone here, part of the African American Community Task Force. I want to speak briefly about one initiative to this component that we call Tell It Like It Is PSAs. Essentially, what we're looking at is producing some authentic communication with the residents that will essentially dismantle the existing public trust factor between the African American community and local government. We, as a bunch of advocates and organizers and people who are essentially entrenched in the grassroots advocacy, have a connection with the Black and Brown community that may be missing at a local government level. We have an opportunity to connect with them more authentically in fashion, so that when these messages come across about COVID and the testing and the importance, it's not lost in translation, where the trust factor can serve as an impediment to them actually digesting the real information. So this platform really allows us to present dynamic messages in a manner that is understood predominantly in the mainstream African American community to get the message across. And in sum, with regard to this whole initiative that we're presenting in conclusion, the point here is essentially to rapidly arrest decline of COVID-19 in the African American community. That is the purpose here. When you look at each component that we're presenting, we're essentially talking about an aggressive systemic public relations campaign designed to rapidly arrest decline of the COVID by educating the community, providing testing service, collecting data, warehousing data, following up with people, and really educating the community authentically. And I believe with that, there is a video example. There's a PSA that you guys are going to view. Am I right there?
If possible, yeah. Well, that's the perfect.
Okay.
Yo, back up. Give me some space, give me some room. We need about 6 feet of social distancing.
Put your hands on the regular, get this thing.
Wear a mask on your face and stay safe, AC.
Cause you really don't wanna be a positive case.
say 19 to squeeze your lungs, eliminate.
And it's extra rights that don't discriminate.
If you got the symptoms, then get tested.
Listen to the message and tell me, yo.
You're down with PPE, yeah, you know me. You're down with PPE, yeah, you know me. You're down with PPE, yeah, you know me. Who's down with PPE? Every last homie. P is for the proper personal protection item.
Yes, but me, but it's hard to find them.
It's the C to the O to the VID.
I'd rather have this information, now that's who I be.
Call me for the hookup on the PPE.
I ain't the starter, but a brother gonna need it for free.
It's the urban COVID response team to the rescue.
The King County Health Department coming to help you.
You down with PPE, yeah, you know me. You down with PPE, yeah, you know me. You down with PPE, yeah, you know me. Who's down with PPE? Every last homie. Yo, back up, man, back up. Give us some space. We got what you need. We'll take care of you. We got that PPE. You know what I'm saying? Make sure you wash your hands, yo. Wear your gloves, man. If you ain't got no gloves, make sure you wear some hand sanitizer. Keep it in your pocket. You know what I'm saying? Wear your mask, man. Put it on your face, man. Check out the Kent County Health Department website, man. UrbanCOVIDResponseTeam.com. You know what I'm saying? Check us out. Go get the resources, man. We got what you need, brother.
Oh, yeah.
Hey, we would say with that, we're hopeful to entertain some questions. Certainly, thank you to Vic Williams, who's AKA Governor Slugwell within the hip hop sphere, and to Commissioner Womack for putting that video together. It is a draft of the video. It's not final, but it's just an example of where we will be able to authentically communicate, because that's where we're from, our neighborhoods, with residents that are impacted by this crisis.
All right, thank you guys so much for coming in virtually. Do we have questions today from anyone on the subcommittee? I don't see anything in chat. No hands. I do want to just say that I really appreciate the outreach to the community and all your efforts. I want to make sure that, and I know Commissioner Womack will do this, but make sure that we're connecting you to all those different resources that provide all that. I think Experience Grand Rapids is probably going to be a key collaboration with you, our PPE effort, our health department partner. So we just want to be sure that we connect you, and I know Commissioner Womack will do that, but really appreciate your presentation today and look forward to working with you.
Thank you, Commissioner.
Thank you.
Thank you so much.
Commissioner Belcher.
Thank you.
Thank you for the opportunity.
Absolutely. All right. We are on to item 4 of our agenda, an update on, I don't even know.
LUOGs, local units of government.
Yep, Wayman, I'll turn it over to you.
Yeah, so we have feedback from our, well, there it is. So MB, do you want to talk about that? I know you've been
actually
involved.
What you have before you is last week, so I have a new presentation if I'm able to share that. So let's see.
Good to know. Those were disappointing numbers.
Yeah, well, all right. Are you able to see the presentation now? Or no?
We're seeing something that's got like a bunch of.
All right, let's do this.
saved,
How about
so.
that?
I see that now. Yeah.
Okay.
That's a preliminary report on LUOGs. Yeah.
Right. So, so what we have, we sent out the survey to the 35 different cities, villages, and townships. 25 have completed as of today. Over a week ago now, all the remaining units that had not yet completed were contacted via phone and email. A lot of them did say, you know, we're not experiencing as much of a loss in expenditures as it is in revenue. So some of them declined to fill it out. The questions that we were asking specifically modeled the CARES Act language. And so the first question was about the current expenditures that were incurred during March and April in these different categories. This is what we received from the different townships, cities, and villages as expenditures for March and April. I'm going to go through this quickly because it is all part of your packet as well. We also then asked the same question about what were your projected expenditures through the end of the year, because we know that the CARES dollars are through the end of the year. And the projected expenses came back as such. Following that, we also asked what some of their responses have been to the COVID crisis. So you can see that there were a majority of people that were doing delays or cancellations of capital projects or use of reserve for budget stabilization. And then also furloughs were the top responses on that. And then we also asked, what is the greatest challenge facing your community? And you can see the responses there. A lot just talked about the loss of state shared revenue for the next 2 years as being a primary, and then physical and mental health for staff and public. And then we just asked for additional comments. So I think a lot of that came around about just the uncertainty of what the next year or the next 2 years holds as far as the revenue goes. Yeah.
Mary Beth, can you go back? Is that the last slide?
Yep.
Can you go back to the slide that talks about it had all of their numbers next to it?
Will do.
So we need to figure out a way to look at, I'm concerned that you've got townships that are fairly similar, like Algoma and I don't know, maybe Byron isn't similar to Algoma. Algoma has a lot of Rockford businesses and Rockford area business, but you have Algoma at 525,000 and you've got another township that's 38. I mean,
right. So with these numbers, we do have it drilled down by these categories, if that's helpful.
Why do we have any idea of why it's, I mean, Plainfield Township is an enormous township and they've got an $18,000 cost and an Algoma Township has a 500,
So what we would do is drill down into those numbers, Madam Chair, to make sure that we understand them. We're doing something similar with the city of Grand Rapids already. So for Algoma, we would take a deeper dive.
Okay.
Jeff Dode and his team.
Okay.
Yeah.
Okay. Do we have questions on this presentation today? Looks like Commissioner Talon.
No, I was just going to acknowledge the city of Grand Rapids number as well. That seems way out of proportion to the amount that it reported for the first 2 months. And also, as the chair was saying, in comparison to other cities. So yeah, that certainly deserves another deep dive into what is contained in $35.5 million.
Right. Yeah, we were questioning the same thing, and Jeff did follow up last week. We did finally get something from them late. We have not had a chance to sit down with Mark Washington and his team yet, but we will, and we will understand that better.
Any other questions? No hands?
Can I just make more to the comment? If you look across the state, other cities, maybe not as large as, but similar size, in let's say Southfield and other places over in Wayne and Oakland County, for instance. And I was looking at some of their allocations that they had planned for their cities, not to the degree that we're showing here in the city of Grand Rapids for sure. So we'll need to see what, do the comparison, see what's different about what the city of Grand Rapids is doing compared to other cities in the state.
Okay, and I think we always need to remind people that it's not you can't plug lost revenue, it's expenditures. So as much as I'm sure even the state of Michigan would love to use this money for their lost revenue, we can't use it for that. So just want to remind everyone of that. No other questions or comments on this portion? Don't see any.
And COVID expenditures, Madam Chair, is the next item on this number 4. And
Yep.
Jeff has some updates on that for us. So Jeff, you want to take it away? Jeff,
Sure, good morning, everyone. We don't really have any updated on the city expenditures since last Thursday. Those were through Wednesday. They'll get updated again tomorrow. I
Yeah.
believe they did update the external Kent County sources. I don't know if you have a copy of that,
Okay.
Pam or Natasha, to share.
Yeah, that's the last update that you provided last week. Wanted to make sure that you were the
Can we scroll?
that's not the one. That's where's the COVID expenditures? That's what we're looking for, Pam and Natasha.
I'm not sure we have that document, Wayman.
Okay.
I know Jennifer sent out a new one this morning about the other Kent County expenditures. Other than that, the internal one has not changed since last Thursday's meeting.
Okay.
So we're running at I think 4.4 million is what the number was last week, Thursday. That's what I understand, Jeff. Has that moved beyond that number yet?
I'm sure it has, but we haven't updated it. They typically do that once a week, so it should be tomorrow. We're going to work on that.
All right.
So we'll have it for Thursday.
Yeah.
And that document with the 4.4 million is on the new website as of the 20th.
It should be, yes.
Yeah, it is. It's accessible there.
Yep.
Can I go back to the first portion of this again, and just say that we have made several attempts to contact any outlying municipality that has yet to submit. So at what point is there a cutoff? I mean,
I think we were going to call it as of the day, or Wednesday this week. Wednesday this week is when we're going to call it, Madam Chair.
Yeah, I guess I'm just, or if you could provide, Mary Beth, maybe you could provide who's declined, so it doesn't look like there's still 10 out there. Maybe there's 5 of them that just don't have any. I don't know, which is fine. It would just be nice to know that, or if you could let us know who they are, because maybe their offices are just closed and they're not getting things, and we could personally contact them in other ways. But I just don't want to keep holding this open waiting. So
Yeah, I can follow up with that, Madam Chair.
okay, thank you. All right, any other questions or comments on item 4? You don't see any hands raised, so let's move on to item 5, CARES Act allocation strategy preliminary recommendations.
Okay, Steve Duarte, are you on the phone? I'm assuming you are.
Yes.
This is the document that we talked about, Madam Chair. We met with Madam Chair briefly on Friday, and Steve has worked on this over the weekend. This is very preliminary, but gives you an idea of what we are thinking the board might accept and embrace. So Steve, you want to take it away? And Madam Chair, please add your comments, but this is what we've identified as being a potential for consideration on a move forward plan. So Steve?
Yes. This document you have in front of you isn't set in stone. What the idea was to recognize that 114 million is still limited resources, and we can spend this money many times over probably. So what we think the next move needs to be is to come up with preliminary allocations based on what the board's priorities are. And then once those allocations are made, obviously we'll have to set up a process for what the roles are, how you qualify, what can happen there. This, going down the left side of it, you can leave it where it is right now for a minute. The top line says, okay, we had COVID relief funds, CDR of 114,533,581. And then going down the left side, we identified county expenses. Right now, the best estimate that we have is that will be about $40 million. And going down the left side, you have the emergency operation, contact tracing, homeless population, Center for Temporary Housing, Public Safety, which is the Sheriff's Department, an amount identified for work, return to work for county facilities that we'll have to decontaminate and make sure we have adequate PPE, implementation assistance, which would include outside accounting and legal service, among others, economic stabilization, and then out of that 40 million, we still show an unallocated amount of 8.3 million. Then going down the left side further, some of the major categories that we've identified: business assistance, small business grants and loans. Tentatively, we allocated $10 million to that. Return to work PPE, that's in red because we took action at the last committee and talked about allocating $2 million for that. Moving down to mitigation of homelessness. Again, no magic to how these are allocated, but homeless and affordable housing strategy allocated $3.5 million. Rent and eviction assistance, $1 million. Hotel motel value vouchers, $500,000. That would be a $5 million allocation there. Moving down, care for vulnerable populations, mental health allocated $1 million, child care $4 million, senior citizen assistance $2 million. That would be $7 million allocated there. Compliance with COVID-19 related public health measures, internet access to facilitate social distancing, allocated $1 million. Assistance to local government was put at $17 million. And then we talked about having a reserve in case there's a second wave. We allocated $20 million as our target. Given the allocations we've made or that I have just laid out for you, we have currently $32,533,581 is unallocated. I think the footnotes are worth looking at. Allocated by subcommittee was at $2 million. Allocations are not a mandate to spend, but are intended to supplement, not replace other funding sources. Restricted funding sources are to be spent first where available. With that, I would take any questions on that, but that's kind of our first brush at this.
All right, so Steve, do you want to kind of talk a little bit while we're waiting for hands up, the methodology of how you, some of these were kind of estimates that you're hearing, some of these are specific, like for instance, I do have a question on, we've got mitigation of homelessness, which I remember we had the presentation from Vera and Cheryl about the rental assistance, and so that's at $4.5, $5 million, but then up above, I think we had another housing issue. So I'm just trying to make sure I'm keeping these straight. And then just some of these others, I would just wonder, like childcare strategy, mental health strategy, senior citizens, are we kind of just, from what we're hearing, kind of pulling together numbers? Is that the thought?
Yes. Steve, you want to answer? Go ahead.
Well, which one are you asking, Wayman? Which one?
Related to the homelessness and affordable housing strategy, she asked about how we broke that out, and you may want to talk about the hotel motel vouchers as well.
From my point of view, it wasn't, like I said, these numbers are not magical. I looked at the overall request I heard coming in. That was about a $5 million number to do this on a long-term basis. But again, my goal was to show some allocation and then have the board, based on their priorities, either upper or lower. You know, do we want to put more in small business than we do homelessness? It would just kind of get the discussion going.
Because two things that I'm concerned with the homeless issue. One, I want to be sure that we're obviously using the restricted funds first, which I see you've got a little notation there. If commission members note at the bottom, we're going to try to use all the other restricted funding sources first before CARES. But then two, I know that Family Promise has a bill coming due, which I think that's our next item, but I want to be sure that we are taking care of that and you know, we address that. So I just want to make sure we're there.
Yeah. When you talk about, can I just say something, Steve? So when you talk about the total number that's identified, homelessness and affordability housing strategy, that's 3.5. And again, rent and eviction assistance, 1 million. These are bogeys that we have identified. It doesn't necessarily mean, well, as we get through the restricted funding sources, those numbers could be higher or lower based on what we find out. But for sure, the hotel motel voucher issue is an important issue that we need to act on now, because at the end of the month, they will lose their stay if they can't provide we can't provide them additional funding. So that's the next action we're going to take.
Okay, it looks like Commissioner Brady has a question.
Yeah, thanks, Chair. One question I have is, in the event that the money that's currently allocated or expected to be allocated, what if that goes unused? What happens to it? Does it roll over? Where does that money go if it's unused?
I'll wait for Steve to answer that. Go ahead, Steve.
I would expect that my intention is that one bullet point that says it's not a mandate to spend, that it will become available to reallocate it through the various process or priorities that we have, recognizing we may allocate too little in some areas and too much in others. I think we reshuffle that as it becomes better known. I think we are also uncertain how much restricted funds, for instance, FEMA has been tough to get a number out of, but it would be my intention as we set up these allocations and we set the parameters for them and how you qualify for it, then you would allocate the restricted funds for first. If there were other donations that came in, we spend those first. If we ended up with money left over, say we allocated 5 but pulled $1.5 million in from other sources, there'd be $1.5 million we could reallocate it to other priorities where they're needed.
Yeah. Steve, the point that you and I and Chair Boulder talk about too on Friday was that these are buckets, if you will. These are buckets that are kind of placeholders. In some cases, we have a more definitive idea of what we anticipate spending, and in some cases we don't. Like the one for Grand Rapids, for instance, we're going to dig deeper about that one in Algoma Township. We're going to dig a little deeper, so we're not sure what's going to be the net result. And then at the outset of this CARES funding, we are on a timetable to spend these dollars out by December 30th of this year. Correct, Steve? That's the other factor that we're working with. We need to move and begin to assess where should we place these dollars first, second, third, and fourth. And so over the next few weeks, we'll be coming back to the board with more definitive recommendations through the normal finance and board process for recommending these allocations to take place.
Commissioner Jones has a question.
Thank you, Chair Bolter. So you mentioned the time frame, Wayman. We are looking, it's March 1st through December 31st. Is that correct, or is it December 30th?
December 30th.
Okay, but it does start March 1st, correct?
Correct.
And then is the bigger picture plan to have our community partners be the lead in allocating from the allocation we give them? So for example, when we look at the small business loans, how is that going to roll out? And do we have that definition of small business?
We think we have a partner. We need to finalize the partner, but we think we know who is going to be the partner to help make that determination, help make those allocations take place. The county will be involved. We'll have our accounting team, we'll have auditors involved, but we think we have a partner that has experience based on the feedback we received a couple weeks now the Grand Rapids Chamber of Commerce and the Right Place, one or both of those organizations are the likely supporters for that.
But is that the case for all of these monies, that it won't be anyone applying directly to the county? There will be a county partner that will assist. Is that correct?
Yeah, for instance, in a situation with part of the homelessness issues, it is the organization called Family Promise, Cheryl Shook's organization, that would be responsible for dealing with vouchers for hotels. And they will then partner with perhaps the United Way 211 organization to manage that process. They have a unique process that they already have for managing a lot of those dollars. And we heard the presentation from Diana Seeger and from Julie Reidenauer and Michelle Van Dyke about their process. So we potentially could partner with them on a lot of the homeless opportunities.
Thank you.
So I know that we all enjoy getting together for several hours on Tuesday and Thursday, but I do want to start getting true feedback from subcommittee members. Couple of things we've talked about the homeless issue. I think it sounds like those numbers that we've got in here are pretty solid in terms of the requests that have come in and what we've heard. I think we do need to make a decision fairly soon on whether we want to keep this $10,000 or $10 million small business grant loan number, because my intention would be that we would probably get a presentation from the Grand Rapids Chamber on Thursday to talk about that methodology, but we need to start kicking this money out. Businesses are suffering, employees are suffering, things are starting to open up and they don't have, we kicked out the PPE early. We need to decide, is this the number, so that we can at least start getting those plans in place and proceed with a subcommittee plan that we move out fairly soon. I believe it's got to go through finance yet and full board yet. So we need to start making decisions. I see Commissioner Steck's hands up, but I do want that input from commission members. Commissioner Steck.
Yeah, thank you, Chair Bolter. I guess my question, you addressed it a little bit, but it's a process question. As much looking at the issue of, do we first fix the amount of these larger buckets and then do the drilling down within that, or are these buckets simply going to be estimates, predictive, but not necessarily controlling of how we allocate the funds?
Mr. Steck, the process will be exactly what you said. These are buckets, large buckets, and then the drill down will occur prior to you, the Finance Committee, having a proposal or recommendation in front of you. So these are the larger buckets. There are some things we need to move on, as Chair Bolter mentioned. The PPE, for instance, we moved on last week, and then now we got to deal with the hotel vouchers. But each one of these will have a drill down component to it, whereby when these come to you, you're going to have recommendations based on the best information we have, the best plan that we have for implementing the movement of these dollars into the community.
So, but as the committee, then our next deliberation, other than dealing with those matters that have some urgency, and I understand there are some, the next focus will be to come back and see where our consensus is on the allocated buckets.
Yeah, my hope would be that by Thursday, you would have some familiarity with this, with all of the materials that we provided, all of the testimony that you've heard, and so on and so forth. You will come back Thursday. We'll have an idea of whether or not we shave, $1 million off this or $2 million off of that. Where we believe that we've put a lot of good work into this. We think we kind of have an idea of how things need to go, but of course, we're at your beck and call. Whatever, however you think we need to go up or down or sideways on any of this, it's your prerogative.
Thank you.
Commissioner Skaggs.
Thank you, Chair. I guess I'll assume that some of the feedback that you're looking for is both, written and email, and then here during the meeting. Just a couple of quick things. the contact tracing and the testing money. As we drill down on that, I suppose the question is, basically, what do we get for that? How many tests? How many per capita tests? Does that reach us to the levels that Adam or the CDC wants us to be at? Sometimes I hear that level is maybe 50% of what we actually need. Obviously, we've got other people doing the testing. Now we have pharmacies, we've got the hospitals, etc. But what is it that we need to be able to do that? And specifically on the contact tracing, we've got $2 million for staffing. That would be something where I'd really like to move us from a volunteer basis to a paid basis, to kind of make sure that we're getting the best available people doing it in the most professional way. Also on that drill down, the issues that I'd like to see what we get for all of this stuff, basically. But I'm especially thinking that's the public safety number is really large, stands out there. What exactly is that for? I know that Commissioner Talon and others have placed an emphasis on childcare, and I think that's extraordinarily important in order to get employees in a place where they can return to work. I think that's mostly what I'm looking at now, other than the bottom part where we're putting $20 million in reserve, but we've put $32 million in reserve. So does that give us $12 million to play with? Because certainly the return to work PPE that we've got in red there for $2 million, was a pilot project. So I know that pilot project was supposed to last a week or 10 days, which is awfully quick to get money back to, or to get information back to us to decide. But it seems like my understanding was our hope that $2 million was an initial request, that if we found willingness in the county, that request might go up and might go up significantly. So wondered if we could get some sort of placeholder there if things go well and we really see a desire from the for-profit and nonprofit and government communities to be able to access PPE, but do it in a more effective way and a cheaper way, and I guess confidence building way, as opposed to just going out on their own. So those are some of the basic questions. Have the rest I'll write down, but thank you, Chair Bolter.
Thank you. Yeah, and I want to kind of just clarify on the PPE for a second. I don't think, and correct me if I'm wrong, I don't think our intention is for the PPE to be provided for every person in the county. It's more for organizations to distribute and businesses to distribute to get back to work. So I just want to be clear that when we are defining that, we're not going to have a warehouse where just the general public can come up and get 50 max, as much as I know, unless that's what we are doing. But I kind of leave that to the health department to know where to put those pockets of PPE and their partner organizations that they know and they trust and are ready to go with some semblance of a organized fashion. So you're right, though. I think that the PPE, that was a start. We're going to obviously need to do more, but I know we can't do the whole county, just general public.
Oh, yes, agreed.
Yeah. Commissioner Womack.
Thank you, Madam Chair. My first question, first I'd like to thank Wayman Britt, his staff, and everybody for all the data on top of all the work they've already been doing. This is just incredible, the information that they're bringing forth. I have two questions, and the first one goes to other subcommittees and staff, whoever can help answer this. When we look at the small business grants and loans, and we think of a lot of stimulus money has been given out at every level, from federal level to the state, through banks, through philanthropy, a lot of times those who are first in line end up being first in line at every door, And businesses who have been last in line continue to be last in line at every door, and trying to see what we can do to make sure some of those businesses, because our chair said it correctly, we have to move and help businesses because there's so many suffering. But there are some out there have received very little to nothing. And as I said, so many are always at the front door and have already received money, and they will still be in line because even the money they receive probably won't fix all the problems they're having. But what can we do, or are we doing, to make sure we're more inclusive to some of the small businesses that have been left behind?
So, go ahead. Madam Chair, could I just respond to that?
Sure, please.
Okay. So we have good intel from the Grand Rapids Chamber as well as from the Right Place about some of the small businesses that did not receive money. So I think that's a start. We have an understanding about, we've even received calls from businesses that haven't received any kind of support. So I think that's going to help us a lot. I mean, they were starting from ground zero. They had limited dollars, $1 million, 1.5 million. Chamber had, the Right Place had $1 million. So I think with that intel, we can do a much better job of identifying the ones that did not receive the funding, and figure out how to make much more happen with the type of dollars we're talking about.
Yeah, and so I want to just to move us forward. Are we comfortable with that $10 million number? And if we aren't, we need to talk about it. If we are, great. But I think my intention is to bring in the chamber on Thursday to talk about their process, much like we heard from Right Place with their process. I know I learned a lot. I think our subcommittee could learn a lot. I want to be sure that we then talk about making sure there are discrimination and discriminatory practices and how we mitigate that, and make sure we're as fair as possible. So I want to try to delay that discussion for Thursday if possible, but I do need to know where we're at and everyone's feelings on the 10 million number. Commissioner Talon has his hand up.
Oh, I had one last question. I had asked if I could ask two.
Oh, I'm sorry, Commissioner.
Sorry about that.
Continue.
My last one, I don't know if the health department is, anyone from there is listening in or connected with us. But when it comes to the contact tracing, just very short, because I know we were here last week way past time, but very short, a little more information on how the contact tracing is done, and does it require participation from patients, and does HIPAA laws get in the way sometime?
Okay.
Great question. Wayman, do you want to take that, or
Yeah, we can take that with us and get back, but I don't know if Adam London's on the line or Teresa Branson. Anyone from the health department? We did not plan to have them here, but we can get you those answers. How is it done? Who's responsible? How does it affect HIPAA and so forth? We can get those answers for you.
Yeah, and how much participation it takes from those patients. Just if we need to get more information out in the public, because I have family members who have COVID-19, and just seeing how secretive some of them are, like, hey, don't tell anyone I got it. Don't tell anyone my name. Don't tell them. Like, okay. But people need to know so they can know if they've been in contact with people. So just putting more information out to the public, how the participation of these patients can help us. Thank you very much for
Thank you. I'm sorry, I didn't mean to cut you off. I thought you were done.
Oh, I'm done. I'm done. I just saying thank you, Wayman.
Commissioner Talon.
Thank you, Chair. First, I got to quickly say there is a great video on the Health Department's website by Brian Hartle, epidemiologist, talks about contact tracing, how it's done, and goes into great detail. So I highly recommend checking that out. It's great background for all of us. The reason I raised my hand is I'm really uncomfortable saying, yes, I'm comfortable with any of the numbers on this. This is the first time I've seen this spreadsheet.
Okay.
And I'm really not prepared I need to see it in context. I asked Pam, she has sent it to us so we can scroll around, but I'd be really uncomfortable approving any of this. This, I think, needs to be a work in progress, and yeah, I'm not comfortable with approving any of these at this point since it's the first time I've seen it.
Okay. Well, we will hold on the 10 million, but and I wasn't asking for an approval of this entire document today. This is a starting point, but we can't drag this on either. So I would fully expect that subcommittee members will take this, work off of it today, tomorrow, Thursday, but we need to start moving on some of this. The small business grant process, which we all know everyone is literally starving in the community because they need the help. That's not going to be stood up tomorrow. If we approved it today, they could not get that going tomorrow, as far as I know, because we still have to discuss criteria. We have to discuss the parameters. We have to discuss potential auditors, outside auditing of this entire fund. So I'm just trying to get us to some semblance of a number, because we've got to start thinking about scale and scope for whoever does administer this. So if we're not ready to do it today, that's fine. We need to get moving on it though, pretty quick.
I recognize that, and just a quick follow-up, I also want to encourage us to be very careful about having too much feedback, too much discussion offline, since this is a public process that we've taken on, and really would like to see us have some time set aside next meeting to talk about this, and questions today, but opinion sharing next time.
Okay, that's fine. I mean, that's kind of the purpose of the subcommittee. Is I know it's awkward on Zoom to virtually raise your hand, but that's what we're doing. So any other questions or comments on that? Commissioner Steck. Commissioner Steck, are you muted? Can everyone else hear him?
I can't hear him. He's
Can
muted.
you hear me?
Now
we can.
All right. Yeah, so I certainly, thank you, Chair Bolter. I certainly concur that we need to move the conversation forward, and looking for a way of doing that that's manageable, because it's such a broad conversation. And so I like the idea of starting to narrow down by identifying these buckets as to whether or not they're acceptable, workable buckets, knowing that they may have to be revised going forward. So I would encourage that to the next meeting we try to come to some consensus on that. It would be helpful for me, though, again, to have again, this is the first time I've seen this document too, and it's helpful, but if we could have some further articulation of what's included within these buckets. So the small business, for example, what is small business, what's in, what's not. But we have a little better understanding about some of the details of that. So just encourage Wayman if we could do that for the next conversation, and hope that by Thursday, I guess it is, we're able to move into that.
Okay.
And that might be one of the most subjective line items. That's why, again, I'd like to bring in the chamber and spend some time on Thursday discussing that. We will have to figure out that criteria, and we will need to start moving. Again, I'm only asking for us to start thinking about what the number is. So take this document, you know, a lot of these, the county expenses, that's stuff that we know, that's staff. I mean, we do need to walk a fine line of us not micromanaging staff and us getting information. We need to get as much information as we can. We had a great presentation on the homelessness issue, I think, a couple weeks ago. So we're starting to get that information, but and of course, anybody who needs information, you're going to get it, but we need to get the requests in and get moving. Any other questions or comments, Commissioner Jones?
Thank you, Chair Bolter. So I was curious, when we listened to the Right Place, they made it perfectly clear that they had way more applications and they had funding for the first wave of grants that they had go through. And I was wondering, unless it were opposed to having any money at all in that bucket, which I am very much in favor of, why can't we get an okay to engage the chamber to start? And the money part, we can continue to discuss that. And it actually would probably be helpful if they started and we could have a foundation of how many applications come in. I was just wondering what the holdup is on starting them to engage.
Well, again, I scheduled them for Thursday, so we will have more details hopefully then. But yeah, you're right. I mean, we probably, if we give the okay once we hear from them that that's what we want to do, you're right. Maybe we don't have to have that specific number right away, but I think for them, they know how much work and effort went into the 1.5 million and how much staff time and effort and hours that went into it. They kind of need to have an idea of scale. Are they handing out 2 million? Are they handing out 5 million? Are they handing out 8 million? That's what I was hoping to help provide, but we'll wait till Thursday and proceed from there. Commissioner Morgan.
Thank you, Madam Chair. Can you hear me?
Yep.
Okay. Hey, I like to look at things in very broad perspectives, and when I look at this, I know we have about $115 million in the pot, and I think this is a pretty good start of a blueprint by staff, because when I'm looking at it, I'm not really sure, and I'm going with staff that. Okay, so we have about $5 million. I'm just picking this out for homeless. I don't know what the homeless population is, but I do know from the presentations that they're going to need money. And then I know that the small business grants and loans is going to probably, there's going to be so much demand there that maybe that's not enough. But looking at the overall picture and the big picture of this, I think it's a pretty good blueprint for us to get started. Thanks.
Thanks, Commissioner Morgan. Let's see who else. Commissioner Talon.
Thank you, Chair. Scary Roger, I would concur with that. I do think it's a good overall picture. The one piece that I just want to raise that I don't see, and we had a communication about it in our email about this meeting, and that's the additional expenses to 211. And wondering if that is embedded somewhere in here or if it's something that we could consider adding, because that's a significant piece of the work that's going to respond here.
So a couple things. We did also get a request from Latinx GR to address us. So my intention is that they would come in on Thursday. Wayman did speak to, Wayman, you can speak.
Michelle Van Dyke, yes.
He did converse with her last week as well, and she did send us something that she would be submitting. So yeah, we still have work to do. This is a shell draft to try to start pulling in some sort of form. This isn't final. This is just, I had a concern that there's not maybe I missed it. I think we're going to need a marketing component to this. We heard from our first presenters today that we need to be able to get out in the community, and we're going to have to engage somebody to start doing that. So I think that piece is something we need to add as well. So I just want to, just say that this is just a start. This is a starting point. Anyone who's seeing this on their screen from the public, this is a starting point. These are all going to be transparent documents. We want to be clear on that as well. This is not the end all decision. This is a starting point.
And if we could move down the document here briefly, care for vulnerable populations, mitigation of homelessness, all those areas could be, in fact, areas that 211 could benefit from, Commissioner Talon. And then I'm not sure exactly what the request is going to be until we see it. But again, like we said, we can shift these dollars around to support what those needs are. We expect to see that report tomorrow afternoon, in fact, from 211.
Is that good with you, Jim? Commissioner Talon? Can't hear you.
You're on mute.
You're on mute.
sorry, I'm glad to be able to receive that information, but just want to clarify that those mitigation of homelessness and care for vulnerable populations, 2-in-1 doesn't do any of those. They make referrals to those things. So they have additional staffing that they've had to hire just to handle the additional volume related to COVID. So yeah, if I could see them being embedded in care for vulnerable populations as an additional line item, but we'll see what their proposal is. Thank you.
Right. Yep. Any other questions or comments? I don't see any hands raised. I really want to thank staff. This was a ton of work. This is kind of the beginning culminations of hearing from the entire community and all the input they're receiving from all over the place. So again, thank you, Steve and Jeff and Wayman, of course, and Pam and Mary Beth and everyone who've done so much work on this. This one little sheet of paper is a lot of time and effort. So I just want to, again, thank you. I would ask subcommittee members to look this over, really digest it, get to us in email what you're thinking, and make sure you're bringing your concerns or comments on Thursday. Like I said, I'm still missing a piece on the marketing and communications effort, I think. And I want to again reiterate that these items, these big items, you know, our departments that would normally handle this will partner. And I think that's one thing that we need to include in our comments in our subcommittee report to the board is we want to make sure that we're not just reaching, you know, groups that we always, you know, work with, that we're making sure we're reaching everybody in this community, because this is affecting us all. So with that, I don't see any, oh, hold on. Don't see any other subcommittee comments. So we will move on to item 6, homeless families request.
Yes, this is a request to support the efforts for the hotel motel use for people that were in Salvation Army, I'm sorry, Meltwater Mission and other places due to the COVID pandemic. We heard testimony from 3 individuals, one specifically from Cheryl Shook from the organization called Family Promise. And so Steve and I have met with them. I think we've vetted out what the need is, and we're recommending that we move ahead and take care of this. They will be due to be evicted from the hotel by the end of this month if they don't receive an additional funding. They had received funding through the philanthropic community, but as we heard from the group that presented, United Way, Steelcase Foundation, and Community Foundation, they're not able to continue to meet all that need. So Steve, is there a document that we received? Is there something that's out there on the attachment list, Pam? I'm not sure. That speaks to this?
I did not receive anything, Wayman.
Okay. But there is a formal request in from them. I believe the number, Steve, correct me if I'm not wrong, they need about 400,000, or is it somewhere south of that? What's the number that we need to fix this?
The number to get through mid-July, make sure I'm not muted. This number to get through mid-July was 280,000. That obviously doesn't fix the problem. We currently have about 64 families that are being housed in a hotel. It's not the same families that started. They've been averaging about 60 families. Right now we're at 64. I believe it is around 20 families we've already placed in housing. So this is an ongoing work, and then try to place them in housing. Right now, 280 to get them to July 15th, I believe.
Yeah, and then beyond that, of course, if they don't receive any other source of funding, they'll need it beyond that. So, you know, I would hope that the board would be supportive of our spending up to $500,000 if need be to manage this COVID period of time that we're in the COVID. And again, like we did with the PPE last week, we would go through the same process by which the board chair and I would approve the request with the support of the vice chair and the minority vice chair, and of course, support from our fiscal services director, that same process that we are using for the PPE.
How do commissioners feel about that? I do need your input. I would like to do the same process for this that we did last meeting with PPE. Anyone have a hand up? Or should I just call on you individually? Commissioner Talon.
Thank you, Chair. Just clarification, it sounds like we're kind of postponing an overall commitment for addressing homelessness for both housing, prevention, and shelter, and focusing on the immediate need of shelter. Is that what I'm hearing? And basically concurring that the administrator and board chair would approve that initial amount. Is that correct?
Well, that's what I believe. We have a bill. I think it's unfortunate we don't have that documentation today, but there is, I think, a demonstrated need and urgency in that sheltering bill that's coming due, I believe, in 2 or 3 days. So my thought was we get that out like we did the PPE approval. But again, the entire homeless and sheltering and rent assistance effort is not being postponed. It was just in the document we just looked at, but we all had asked for more time to digest all of that. So what we're trying to do today is request, and it is in Wayman's authority that we provided at one of our early board meetings during this pandemic, but we want to get that bill paid for them as quickly as possible.
And if I could just follow up, my concern, I recognize the importance of that and support it wholeheartedly. The reality is that if we don't approve spending for those other areas, it means that people have to stay in that shelter longer. And if we can't get them out into housing, or if we can't prevent them from becoming homeless, it's going to cost more for that shelter. So
yep,
it's got to be a both and here. Got to be a both and.
Well, again, we have to approve that. We have to approve that. So,
Commissioner, Steve Duarte has a comment, I believe, related to this. Steve, can you share?
One of the things that we haven't resolved yet is, are there other funding sources available? You know, we're still looking at FEMA Category B funds for part of the solution to this. We're still looking at hoping that Grand Rapids, the city of Grand Rapids, will put some ESG funds in there. We have some ESG funds ourselves. So that's kind of why we haven't proposed a final number for overall housing project. This amount here is to get them, if they don't have a commitment for funds by June 1st, then they're not going to be able to keep these 64 families housed in a hotel. So they're kind of separate. I mean, they're related, but they're kind of separate issues at this point.
So I'm trying to take care of this initial need right now. And then again, we need, Commissioner Talon, I think you and I are on the same page on this. We know what we have to do, but we have, like Steve said, different funds coming in. So we're not trying to approve a housing plan today that none of us have seen the documentation on, and other than the presentation, what we're trying to kick out today is the bill that is due for the family sheltering that needed to happen in the next 2 to 3 days. So that's what I'm trying to do today.
I would just point out that we doubled the allocation for PPE for businesses without seeing any data to really support it and what the implications were.
But this funding that we're trying to do today is not the whole total housing and shelter issue. It's the immediate bill we had before us. I mean, you can vote no and not approve it if that's, I mean, I'm confused as to why we're debating this.
I'm just saying we need to do it all, because this has the potential to be throwing money down the drain if we're not also doing the other pieces. So I'm just trying to press the urgency of those additional pieces in addition to the shelter.
And you're speaking the language I spoke earlier about approving the whole plan very quickly. Exactly. Any other questions or comments? Commissioner Skaggs.
Are we voting? I'm an up.
Thank you. Commissioner Morgan, are you okay with this?
Well, let me unmute here. I guess I'm getting really kind of confused. We started out by saying, boy, we need more time on this, and now we need to push all this stuff out. So I'm going to get back to, if we need to push the money out, let's, if we allocate $500,000 to this or whatever, it's still going to be in that bucket, right? And so that may be available after July, correct? So
Correct.
I guess I just don't understand, and it just really baffles me. But you know, I don't have the intellect to follow all of this all the time. But it just seems to me that it's really important for us to get this money out and available. And if we have confidence that our staff has done the right research and we do have a need, I don't understand what all the what all the talk's about. So I'll just leave it at that.
So that I assume you're an up for 500,000 for the sheltering bill.
Of course.
Okay, thank you. Commissioner Jones?
Yes.
Did you have your hand up or you just wanted to concur?
She said yes.
Commissioner Steck?
Yes, thank you, Chair. I did have my hand up as well, but I do support this. I think that it's consistent with the ask and the information given to us. It clearly has a degree of urgency, and I think you've acknowledged multiple times this is not the end of this conversation. There are other pieces to this, as Commissioner Talon points out, that we will continue to have to address. So for now, as we did with the PPE, I think we need to push this out immediately and continue.
Thank you. Commissioner Breeby?
Yes, I support moving this.
Commissioner Womack?
Yes, I do support what the staff has brought, and I think it was really enlightening to hear from our chair that this is just the beginning of getting the ball rolling, and we'll continue to be at the table helping this community as bipartisan as we can, as inclusive as we can. So I do support it.
All right, so we have support for you, Wayman, to proceed with that.
Okay, will do.
Thank you. Anything else on that item? Commissioner Jones?
No, I don't have my hand up.
Oh, okay. Any other questions, comments, concerns? All right, moving forward, item 7, subcommittee documents.
Yes, in your packet, there's communication from the Latinx community and the United Way 211. We did receive correspondence via email from Michelle Van Dyke regarding 211. They will be providing us a written recommendation on hopefully tomorrow. And then we're hoping that we can have the Latinx community come on Thursday for a brief presentation.
Yep. Okay. And then at that point, just so commissioners know, and speaking Commissioner Talon's language, we need to move on this. So I think we're going to start to cut that off at this point. We need to start making decisions. Anyone else that has questions, concerns, comments, we'll probably be taking them via email and moving forward. So with that, I hope that we have a great meeting on Thursday from the Latinx community and the chamber. I think you'll have a lot of questions. I hope commission members do some homework in the next couple of days to provide us with your questions, comments, and concerns. I also would encourage you to talk to our other board members, as I will be, to make sure they're kind of up to date if they're not listening into our subcommittee meetings, so that they kind of know what's going on, and we can help to expedite the process once this gets to the board. So with that, do we have any miscellaneous today? Commissioner Talon.
Madam Chair, could you state again who we should send questions, comments, and concerns to? Just you, or to you and Wayman?
Wayman's collecting all of that.
Okay, thank you.
Any other miscellaneous today? Commissioner Womack.
Yes, I just want to say that thus far, with the subcommittee, this has been one of the processes that I watch here at the county that's been the most transparent. So I just want to thank the chair for that. I want to thank all of the organizations that have come and spoke to us publicly, since that's the only way we're really taking in most of those requests. And by them coming in publicly, not only did I get a lot more to learn about their process, I know the public had a chance to learn a lot, and I've had a lot of constituents and voters in my district talk to me who have been tuning into these meetings, just how educational and informative they are. I just hope that other commissioners can stay open-minded too, that we're going to have groups that may be smaller, that will come in, but have boots on the ground. We have neighborhood associations that are struggling themselves, that are being bombarded by community members that they've always been able to give them answers, and trying to do their best to answer some of the questions of the residents. But those neighborhood associations, everybody's hurting from the COVID-19. I'd also ask the public, as they take advantage of public comment, to also have a chance to email some of the commissioners, because as we mentioned, time is of the essence to get to helping these small businesses, and the commissioners and the staff at Kent County are putting in a whole lot of time, but we definitely are looking for information so we can make the best decisions. So anybody in the public that needs to email me, it is at Assets Kent, as well as the other commissioners. And just proud of the whole subcommittee for the work that you're doing. Thank you.
Thank you, Commissioner Womack. Commissioner Brebe.
Thank you, Chair Bolter. I'm not sure if this was covered previously in the meeting, but could we get a status update on the PPE that is supposed to be available for businesses? Where can we find that, and when will we see that?
Wayman.
Yes, we can provide you an update. Cal Brinks is mobilizing that effort. We will send out an update for you today to tell you where we are in the process. But he is currently negotiating with the support, that the logistics for getting that information out, and we'll give you an update later today.
Thanks, Wayman.
Yeah, and I know the right place had asked me about that too. So as soon as we can get that information, that'd be great. Commissioner Morgan.
Thank you, Madam Chair. Just a note, I have a commitment Thursday that I cannot get out of. I'll be joining that meeting late.
Yep.
So I want to let you know. Thank you.
You'll be missed. Any other miscellaneous? I want to also just say that public comment, I'd like to start making sure that we're kicking that out to the board members so that they can see that if they email us. That would be great, so that we all have that in that folder. And I want to be sure that all of our commission members and our board members have access to all those documents. So Wayman, can we have Mary Beth circle back with everybody so that we make sure everyone has all the documentation they need?
Sure. Yes.
It looks like Commissioner Talon has some more miscellaneous.
Thank you, Chair. Just to follow up to Commissioner Womack's statement about getting information out, I really want to encourage anyone that's viewing this meeting and my colleagues. I've had so many questions from people that are answerable on the Kent County Health Department website, and I really want to encourage people to go there. There is a wealth of information about resources, about how the county is responding, how the health department is responding. So please go there, check out those resources. They're invaluable, and my colleagues as well. It's a resource for us to be able to refer people to. Thank you.
Any other commission member miscellaneous today? I don't see any other hands. I do want to remind the public, you can email us at publiccomment@kentcountymi.gov or our individual emails. Pam, did we have any public comment today in the email box? Don't see anything. Pam?
Pam or Natasha, are you there?
I am here checking email box.
Yes, I'm here. I checked the inbox. There is an email message here.
Okay. Can you read it?
Oh, yep. It says their mission-focused services have to keeping our community healthy. Thank you for your work during these challenging times.
Great. That was it?
Yes.
All right, we are adjourned till Thursday the 10th at 10 o'clock. Thank you so much.
Thank you, Chair.